Good afternoon, everyone. I'm John Horowitz, President and CEO of Easterseals, DC, Maryland, and Virginia. Our vision is to create a hopeful, inclusive community where all people realize their potential and live meaningful lives. Realizing our vision of hope and inclusion includes a focus on mental health. Our children are having a mental health crisis. About 3/4 of parents believe the pandemic has taken a toll on their child's mental health. And surveys of children and teens report alarming increases in feelings of depression, anxiety, and hopelessness. We're very proud of our Stephen A. Cohen Military Family Clinic at Easterseals that provides high-quality, evidence-based outpatient mental health care services to veterans, active duty service members, and military families. We also recognize that mental health needs to extend to the entire community, which is why we're so excited to expand our mental health services to the civilian community through a new clinic that we are working to open. We're grateful to Senators Cardin and Van Hollen for their support and are actively seeking community support for this new clinic. If you'd like to get involved, please contact info@ecl.org, and that email address is in the chat. To make today's session as meaningful for you as possible, we're now going to ask you to participate in a short poll indicating your role. Feel free to check multiple responses if, for example, you're both a parent and an educator. While the survey is up, I also want to mention that the Q&A function is active. So if you have questions, please feel free to post them into the Q&A box. And now I'm pleased to introduce our distinguished panelists. Grace Caulfield is the Deputy Director of the Stephen A. Cohen Military Family Clinic at Easterseals. She holds a master's in counseling psychology and is a licensed professional counselor. She also holds a certificate, a certified associate counselor for alcohol and drug credential, and a level 1 trauma certification through the Institute of Advanced Psychotherapy and Training, which she incorporates into her clinical approach and practice. Grace has had almost 25 years of counseling experience and brings her expertise in addiction treatment to child, adolescent, and adult populations. She's worked in a broad variety of clinical settings, including both inpatient and outpatient psychiatric hospitals, as well as residential settings. Dr. Mia Everett is a board-certified psychiatrist. She graduated from Harvard Medical School, then completed a residency in psychiatry at the University of Pennsylvania Health System, followed by a fellowship in child and adolescent psychiatry at the New York University Grossman School of Medicine. Dr. Everett now serves as the interim senior medical director at Community Behavioral Health in Philadelphia, Pennsylvania. She began her career at CBH in 2017 as medical director for Children's Services, and before that served as the director of clinic psychiatry services for the Institute for Community Living in New York City. Dr. Elizabeth Faison is the associate superintendent of student services in Prince George's County Public School, where she provides oversight to over 460 employees who implement a broad array of services, including counseling, psychological, substance abuse, and health. She's served students and parents as a counselor supervisor, and administrator for 28 years in a variety of settings. Dr. Faison holds a BS in sociology and social work, a master's of education in counseling, and a PhD in counselor education and supervision. She's a national certified counselor and a licensed clinical professional counselor, and was named the Advocate of the Year in 2020 by the Maryland School Counselor Association. She's also a mom. I'm excited to hear from these great panelists, but before we do, I just want to share quickly the results of the survey. Okay, so as hopefully everybody can see, we have a large portion of advocates as well as parents on the call. So we'll try and tailor the questions and responses to things that relate to that. So what I really want to start out with as we cover these important topics is going back to the very beginning. And often, I can share as a parent, going back to the beginning really ties into how can we build as parents or as educators trusting relationships with children and adolescents, so that when they have issues, they're able to come to us and talk to us. So maybe we'll go in alphabetical order, and I'll start with you, Grace. Can you share your thoughts on that?
Sure, thanks. And I'm, again, grateful for this opportunity to be together, especially with such a distinguished group of colleagues. One thing that I did not share with my bio is I actually started as a first grade teacher. So I'm actually an educator by trade and training many years ago. So certainly also have that in common with many folks here. And I think, certainly it's changed over the years, but, sort of trying to provide a forum where there's just open dialogue. I've seen parents that we've treated here at the Cohen Clinic trying to help them foster this open line of communication. I think it's much more difficult in this age of technology. I have a 10-year-old on my caseload that was telling me that he texts his dad from the room over, and we're certainly working with that challenge these days. But certainly, again, having new ideas for parents where encouraging maybe a technology-free 30 minutes a day, like no phones at the dinner table, for instance, where we really try to build, because it's a skill set now with children, and trying to, build some of those skills so we reconnect on a level instead of having this, everybody, including adults, everybody, I think chiropractors probably will have successful careers in the future, but everybody's sort of reconnecting so we can have that time to find out, like, how the day was, or what's going on, and then we can get into deeper issues.
Great, thank you so much. So building time in to build connections. Dr. Everett, any additional items that you can share?
Yeah, I would just, those are all great recommendations. I would just say meeting children and adolescents where they are, sort of asking open-ended questions or learning about their interests so that you can connect with them, and being sort of a safe and non-judgmental presence in their lives where they feel that they can share without punitive response or criticism, and feel supported.
That's great. Thank you. Any examples you could share of ways to provide like a non-judgmental reaction that maybe helps open the door for further conversation?
Sure. I think, I think in just your tone and demeanor, physical demeanor, making good eye contact, being relaxed in your posture, maintaining a calm presence. So particularly for kids who may be struggling with their mental health, being a stable presence in terms of how you relate, in terms of your body language and speech. And then also, just kind of leading with a general check-in, expressing concern, and just you saying, just wanted to find out how things are going. I think just being very open-ended and not too directive. And then depending on how the child responds, following their lead, if there's anything you can follow up on based on their answers, to do so in a manner that doesn't feel threatening or judgmental, to just be an active listener and follow their lead. Mm-hmm.
Thank you so much. Dr. Faison, anything you can share?
I'll just use the example of most recently, I am a mom, and most recently, my son and I took time out to just play games. And, games are a really great way of creating this disarming environment of family and togetherness. And little competition always is helpful with kids. They love competition, especially if they can beat you at it. But I think it's just a very known and comfortable way for kids to engage in conversation with us. And it's a way for parents to get to know who their children are, and having that carved out time, which not necessarily intentionally focused on conversation, but it leads to and creates the environment where conversation is absolutely possible. And I just love all the answers that were given before me. I think it's important to just be intentional about it and wise at the same time, where children are not necessarily knowing that we're going into this activity with the end of conversation in mind, but it happens as, an outgrowth of that relationship and that environment that you're creating to have that open conversation. And not with their responses acting shocked and overly concerned with their responses, and not, I think, as was referenced, just our demeanor and our responses in a way that they know we're comforting and we are supportive, and not necessarily taken aback by the responses that we get. Kind of helps them to continue to open up to some deeper, more substantive things.
Thank you so much. Related to that, I was recently at an event with some of our partners in mental health at the Laurie Center, and one of the speakers talked about, part of her learning was to actually demonstrate her own frailty as a mom, and when she was feeling stressed or anxious to her children. And it's interesting because I was always kind of under the impression like, oh, I don't want to worry my children by exhibiting that something is bothering me. And so I'm curious, maybe we can start with Dr. Everett this time. Do you have advice on that in terms of how to talk to your children about maybe things that you're struggling with in a way that demonstrates that it's okay to talk about mental health, but where it doesn't create a worry for them?
Yeah, I think having your child's age and stage of development are important. So sharing things in a way that they can understand and comprehend it, first of all. So you will definitely talk about it differently to an adolescent than to a 5 or 6-year-old, and you may share more with your child depending on their developmental stage. So having a good sense of what's appropriate and what they can comprehend cognitively and emotionally. And I think always approaching it with the stance still that you're the parent and they're the child, and you're not looking for them to fix your problems or to heal you, but just being honest about what you're going through, but not in an alarming or reactive way. So, just sharing that and letting them know how you're trying to problem solve or seek help with your challenges is a teaching moment for them. And also because children often pick up on cues, even if you don't specifically say things. So being honest and forthright, but in a reassuring way, and sort of being problem solving oriented in how you discuss it with them.
Great, thank you. Dr. Faison, any additional thoughts on that area?
I would just only add that when Dr. Everett mentioned it, it's a teachable moment. I think when we're transparent with our children, it is to help bring them along to what's very normal about life. And that while they may be a child and they may be experiencing certain things, to get to understand that we experience those same frustrations and anxiety and disappointment, and that we experience them maybe in a different way based on, what prompted the frustration, but to have that as an understanding that we are no different. We just have more adult concerns and adult issues, but we feel the same things that they do and the same hurts and disappointments. And so that we just create normalcy around those things as an ebb and flow of life. That's a very natural kind of thing.
Yeah, that's super helpful. I think making people aware that, all of these things are normal, and thereby, decreasing the stigma and making people not afraid to talk about it is really a great point. Grace, anything you see that you want to add in terms of things that you see in your practice?
Well, actually, it was both what Dr. Everett and Dr. Faison said. And actually, there's no question based on the data that we see that, 25% increase in depression and anxiety sort of post-pandemic. Like, we're talking about things that we've seen both on the education side and the treatment side that we've never seen before. And so certainly we know that the kids are impacted, even if they're not verbalizing it. So I echo with, we want to normalize, certainly, like, this is sort of, what we're all experiencing, but at the same time, there's not the shame about it. We're all kind of navigating this together. And I think that, on the flip side, the research also has shown, which is we've had the gift of, telehealth, that we're able to reach people and engage, children and adolescents and get help to areas that we never were able to do before. So that's also sort of been the gift of the side of the healing piece, which has been really a great opportunity to engage kids. And also kids that build skill set, being, doing remote learning at home too. So.
Great. Well, thank you. That is super helpful. And it really leads into the questioning. And Grace, you kind of alluded to this of, like, even when your children, don't necessarily talk about it, or, children that are part of your classroom, if you're an educator, who aren't talking about it. And maybe this time we'll start with Dr. Faison. Maybe you could talk a little bit about some of the signs that parents or educators or friends or, adults who are in the lives of children and adolescents could be watching out for.
I support school counselors in our school districts, and clinicians and psychologists. And some of the things that they've been able to convey to even educators and parents alike around, when do we know, that a child may be in crisis or may need additional support, is if they're lethargic, if they seem more anxious or more worried than they have been in the past, or if they are despondent, or they have disconnected from things that they usually have liked in the past, if their appetite changes drastically, if they, ask lots of questions towards, a certain topic, then you kind of know that that's an interest that requires the right information in responding to students. If their sleep is interrupted, or if their weight fluctuates drastically. I just think if the mood, if you see that your child's mood is vastly different from what it was before, they're more snappy, then these are just some of the indicators that a student may be going through something and need additional support, especially if they get quiet and isolated in a way that's very different from what is normal for them. So those are some of the things that we've seen.
Great. Thank you, Grace.
I echo those. And I'm, when we're talking about NAMI, the National Alliance of Mental Illness, 17% of children and adolescents are diagnosed with a mental health, illness or disorder. And, really you're talking about suicide is the second leading cause of death for children between the ages of 10 to 14, pretty staggering statistics. But on the flip side, being on the clinical side of things, and certainly, on this panel of really the solutions. So everything that Dr. Faison talked about, anything that's sort of drastic, yet the kids will try to say, like, well, I'm in my room, again, playing on my phone. I'm in my, lots of, again, some of the kids that I see on my caseload, they're gamers. So the kids are gaming, but from a parent perspective, but let me pop in and put my eyeballs, make sure, it's gaming is okay, but just keeping kind of a monitoring on some of that, to just kind of, having those conversations, because anything that's a real shift but also having already developed, which we talked about when we started this conversation, we've already opened up the communication and bringing some of those tough discussions to the forefront, because we want to normalize, hey, I'm worried about you, and hey, just want to make sure you're okay, because I love you, I care about you, I just want to make sure that you're okay. This has been tough, and all of that kind of thing. It's been really helpful, even though sometimes it's an awkward conversation because kids are like, ew, I don't want to talk to, that kind of, which is a normal developmental thing.
The typical sullen teenager. Which I certainly was one. So, I'm going to ask a little more about that in a moment, but would love to also hear from Dr. Everett, anything you wanted to share around signs to notice.
Sure. Yeah, I would just concur with what's already been said, but would just add, I think any change from your child's normal or student's normal functioning, whether that be academic, social, emotional, their peer relationships, that should be a sign that maybe, you need to address a mental health concern. Oftentimes kids as well, particularly younger kids, if they're depressed or anxious, might be irritable or start acting out in terms of their behavior, but they have an internalizing issue going on that they're manifesting that way. And so I think and sometimes they get punitive reactions from parents and teachers when really they're suffering internally with their emotions. So just to be cognizant of that. Mm-hmm.
Mm-hmm. So really making sure that you're, kind of having the conversation in a way that invites a dialogue versus a blame kind of thing. Is that what you're saying?
Yes. Mm-hmm.
So like maybe if you notice your child's grades are slipping, not saying, well, I expect all A's, but rather, okay, well, that's certainly super helpful. I do want to remind our audience that if you have questions, please do drop them into the Q&A box, but I have lots more, so I'll keep going in the meantime. But I am curious, if we start to see these signs in our children or in children that we interact with, what are things we can do to open the dialogue? And also, if you can talk a little bit about, to the extent that maybe you start to find yourself getting shut down if you open that dialogue by the, quote, typical sullen teen, how can you, make things happen in a more natural way where it doesn't feel like an inquisition? And maybe, Grace, we can start with you this time.
Sure. I think, it's really interesting. The old kind of therapeutic metaphor is like we have to put our oxygen mask on ourselves before we're able to help anybody else. And now that we're, and right now I have it right here, but because I'm in a private space, I don't have my mask on. But sort of this idea that, kind of making sure that parents, and it looks like, since that was the large majority of the audience, really trying to figure out and make sure that parents are doing some self-care. That's, a lot with everybody juggling everything with like trying to do, working from a lot of people who are doing telework and kids were at home, whatever. So if you're finding yourself a little exasperated by trying to parent at the moment, kind of taking a break, having, a timeout from the discussion and coming back. Because I think some of the dialogue of the topics that we're talking about are difficult. And sort of making sure that, we're not doing some of that discussion, sort of day end or, like when we're just not, replenished ourselves. I saw a really great, and I should have sent it out or thinking about this, we don't let our cell phones get all the way down to that very last red bar, and kind of thinking about that for ourselves is how do we like keep ours at least halfway or all the way. When we're kind of engaging in some of these conversations, whether it's parenting, relationship with each other, especially in some of these tough topics, tough parenting moments.
Well, and related to that, Grace, maybe you can share, as a parent, or, how might you deal with a situation where, your child comes to you and you feel like it's such a big problem that you don't even know how to address it?
Yeah, I think, again, so some of the things that we have done, from a professional standpoint is, offering resources, offering things like that. Because sometimes, we don't know, like, and I say to lots of the parents that we work here last time, and I think, again, some of you on this panel are parents, last time when the kids, were born, right after the nursery, they didn't hand you a big binder that said, hey, listen, when this happens, chapter 8, chapter 11, when the, last time I checked, those binders didn't come. Well, that's how old I am. Now it's an electronic version, and so it really is, sort of to try to give resources to folks. So we have a lot of resources available, through the Easterseals, through our resources or the Cohen Clinic, and then workshops. But sometimes we don't know what we don't know. And so that's why I think that I'm so happy that we have this candid conversation and future, workshops or resources, because I think it is knowledge is, power and wisdom to each other, whether it's resources through the school system, through a clinical staff, engaging in therapy, because therapy isn't always meaning that something is acute and wrong. It's just sometimes is building a social skill or something, that we need to fine tune.
Great, thank you. So, if you're feeling overwhelmed, reach out and get help yourself to make sure you can help your child. That's great advice. Dr. Everett, your perspectives?
Yeah, so just to answer I think the first question about, if you get pushback when you try to discuss something, how to approach it. So I would say, accepting if a child, unless it's a crisis situation where there may be a need for emergency intervention, to be willing to revisit a conversation. If a child is setting a limit that maybe they don't want to talk about it in the moment, just sharing with them that you will revisit it, that you're available if they want to come to you to talk further. I would just reiterate the recommendation to kind of engage in what children or adolescents are interested in as a way to connect with them so that they feel more comfortable opening up. And then I think if there are other trusted adults who they may have a connection with, to enlist them in kind of engaging the child in those conversations. And then I would say for parents and educators, for resources, if you need support, I would say for kids, especially, your school could be a good repository of information, as well as pediatricians. They're often sort of, in addition to educators, sort of a mainstay in a child and family's life, and they can maybe connect you to other resources, including mental health resources if you're not fully aware of what's available locally. And then any local chapters of national mental health agencies like NAMI might be able to provide resources as well.
Thank you. So I believe, but we'll check and confirm, NAMI, I think it's nami.org, but we should confirm that and we'll put it into the chat. Dr. Faison, anything else that you would add to this this conversation about, what to do if you're seeing signs or how to engage your children?
I would only add, just to all of the recommendations that have been made, is to find ways to communicate in a way that's disarming. So, for example, you may have to start off with writing a note. It may start off with a note, or it may start off with a letter if you don't have the words, or you yourself as a parent feel uncomfortable engaging in that conversation. I think, sometimes sticky notes to say, I noticed something was up for you. I don't necessarily know what it is, but I'd love to talk about it. And make a date. Sometimes taking your child out on a date is a great way while you're bowling, or, make a date to go to dinner and say, this is just our date night and our date time for me to, support you and hear what it is you want to share. And then sometimes, though, texting is not necessarily what I like doing with my son, but my son texts me from the other room also. And so sometimes using that good old text is a great way to broach a difficult conversation and to put a placeholder to say, I'd love to say more, or I'd love to talk more. when you're up to it. And sometimes those text conversations may continue in a way that has depth. And your child is able to communicate in the way that they do with a lot of their peers via text messaging and via social media, but having sometimes those electronics can work to our advantage if that really is just a child's preference around having a face-to-face conversation around something that's difficult, but letting them know that you noticed, you'd love to have the conversation. And I think having that relationship where you talk in season and out of season, in crisis and out of crisis, builds just that pipeline to be able to talk about anything at any time. And I think for me as a parent, working with my son, who is now 23, there were times when I had to absolutely say, I am concerned, but I don't necessarily know what to do, but we can work it out together, or we can find support together. And I think, just owning when we don't necessarily know what to say, I think is endearing, to our children, because it also lets them know that there may be critical and important times in their lives when they may not have words for what it is that they're feeling or answers. And that researching and finding and that help seeking becomes a skill that we then build together around something that's important.
Great. Well, thank you. That is all very helpful. There's a couple questions in the chat that I'm going to bring up. First, going back to the question about what symptoms should be worrisome to a parent. And there was a specific example where a parent mentioned that they have a son who is now 7, who had previously stopped wetting the bed at age 5, but started again 3 months ago. Is that something to really worry about? And if so, what kinds of things might that parent consider? Maybe Dr. Everett, maybe that's something to start with you on.
Sure. I would say, anytime your child has met a developmental milestone and sustained that for a while, and then they start to regress, that should be cause to just try to stop and kind of understand maybe why that's happening. Specifically with bed, if you know of any particular trauma or stressor that they've gone through, I would open up lines of communication with them about that and see if you can work to try to mitigate the bedwetting with behavioral changes, like things that make it less conducive for them to have those kind of incidents. But definitely I would recommend seeing a pediatrician just to rule out any medical issues, and then they can also give recommendations for interventions to address it. And then if through conversations with your child and with the pediatrician, you understand that there are maybe some mental health concerns, maybe contributing to it, seeking out maybe therapy or other mental health resources to help your child. So it could be medical, it could be in response to a stressor that they just need support with getting through this and getting back to their prior developmental level with toileting. But it could be multiple factors, but it's important to seek out a medical assessment just to rule out anything medical happening.
I think, that's great feedback because it also, presents things in a non-judgmental way, not in a,
yes.
Anything, Grace or Dr. Faison, that you guys want to add, or I'll go into some other questions from the chat as well.
Well, I was just going to add, absolutely same with what Dr. Everett said. We always want to kind of rule out, make sure that there's not something medically going on, but then also to support, like maybe something stressful, something worrying, some anxiety can be kind of a normal response, if you will. And we just want to sort of support that, develop some tools. I know that we've had some clients here that have had that as an occurrence, and we've just put some things in place and helped them sort of through that particular issue, and then it's kind of resolved itself. So that can happen at times. And even for the child to sort of be like, oh, okay, this is sort of what happened. So they don't immediately, add all this shame to everything else. Then they internalize something's wrong with me. Now, they identify themselves by that. So, but always sort of ruling out a medical issue, systemic first, and then kind of looking at something else.
Great. Well, thanks. I think another question that came in the chat is a parent who said, we have 2 children ages 4 and 2, and, they're not acting in a normal way. Both, he perceives it and his wife does. And if they ask, why did you do that? The children don't answer or talk about something else, anything they can do in that situation. And maybe we'll start with Dr. Faison because we missed her in the last question. Sorry, I couldn't hear you.
I was going to just allow Dr. Everett to respond to that one.
Oh, great.
Sure, I would say, I would. So the asking sort of why a child engaged in a behavior, especially at a young age, they may not be able to articulate it or even understand why. So a question you might ask is, how are you feeling? Do you need my help? Meeting them where they are, just to try to understand what may be driving the behavior, rather than focusing on the behavior that you're not pleased with or that's out of character, out of their normal pattern. Just being very open-ended and trying to understand their feelings or how they're thinking, to lead into addressing the behavior afterwards, if that makes sense.
And one thing I'll share, and I think it's kind of similar to what you're saying, Dr. Everett, but one of the things I've read, even about being a team leader is, if you ask a question like, why did you do X, it can create a feeling of blame, versus, maybe asking some questions about how they're feeling, or, and is that kind of what you were sharing? Yes,
definitely. So that they understand that, of course, you're not trying to blame them or critique them or punish them, but really to understand what's going on with them that may be manifesting this way. But your real concern is about how they're doing, not necessarily about the behavior and wanting to shame them.
Anybody else want to add anything on that question? Well, then another key question, and we've already put into the chat the information about NAMI, but any other resources that people, that our panelists can share, because there were some questions, especially about resources to support students in a remote setting, and, having the best ways to provide support to those students and families.
For your listeners and participants who are in the Prince George's County area, to just know that our school system has invested in clinicians being placed in our schools. And so we have a number of community schools, high schools, middle schools that will now have a mental health clinician. We began with about 60 some schools, and now we're due to have 168 schools to have that mental health clinician in our schools, when parents would normally have to make those appointments with therapists and clinicians after school. That resource will be in 168 of our schools this year. And that really is in addition to the school counselors that have always been there, and our school psychologists that have been on board to be able to provide support to students. I would say additionally, there are times when there's a loss of a student and a staff member during the day. And so we always send crisis support to those schools so that students and staff can be supported during those most difficult days when they learn of the loss of a staff member or a teacher in a child's classroom. And additionally, we have a mental health website wherein parents are able to utilize that information to seek out additional information. And we've developed a mental health email address that is mentalhealth at pgcps.org, so that if there are ever questions that our parents have and they can't get the answers from someone in the building and they prefer to just email our office, they can do so at mentalhealth at Prince George's County Public Schools.org. So those are some of the resources that we utilize. I would just talk about the Dougie Center as a resource for those who have lost a loved one. We know during COVID, many students lost friends and relatives and loved ones, as did their parents. And so going to the Dougie Center or calling upon them for specific grief counseling services has been extremely helpful for some of our families recovering and really healing from the loss and able to cope with the absence of a loved one. So those are some of the general pieces, as well as some of the suicide crisis hotlines that we refer our parents and students to when there is offline need for that. I would just lastly say that we now are moving into having that telehealth service in our schools during the day for teletherapy through Hazel. And that's something we rolled out new this year for our middle schools and our high schools during the day. And then in the evening, elementary through high school will have access to teletherapy for families who need that, as well as for medical support in the evening. So those are some of our most critical resources that we provide as a school system to our students and our families.
Great, thank you. Grace or Dr. Everett, any other resources that you want to share with the group?
Not any that I can think to add.
I know that in Montgomery County, we are really lucky that, similar to what Dr. Faison alluded to, and I'll try to look at it in a quick second so we can drop it in the chat, because I'm not quite as quick and savvy, but we have quite a wealth of resources as well to echo that for telehealth and some of the capabilities, as well as in the school systems, because I think it's an access to care issue, to making sure that, there was certainly an issue with trying to connect school counselors and guidance counselors and so forth. But on the flip side, at least in Montgomery County, there is sort of a wealth of resources. So I'm going to try to get the link before we leave today to drop that in there as well, to have that for folks.
Yep, and I'm also going to drop in some links for the National Institute of Mental Health that has some good resources for child and adolescent mental health opportunities. I want to give our panelists a chance, to close out on this part of the topic, because we also have a lot of questions about advocacy in the chat, and I'm going to turn our discussion in a bit to discussing advocacy. But a couple of things, just again, something that came up in the chat is remembering that we can show, our own emotions and vulnerability, as we kind of talked, circling back to the beginning of this conversation, as adults. But anything else that you want to share before we turn into a little bit of discussion of advocacy?
I just wanted to flag, I should have mentioned this earlier, but the American Academy of Child and Adolescent Psychiatry, it's the professional organization for child and adolescent psychiatrists in the US. They have a website with resources for families and youth, mental health resources and information. So that could be helpful for folks looking to provide additional support.
Okay, well, one other thing that did come up in the chat is a reminder that a lot of insurance companies also have support services available. And, I'll even share also, often there are employee resource programs through insurance companies and employee referral things. So if you need help, do remember your health insurance as well as your other company benefits that you may have. So now I also do want to mention, because a couple of people have had some comments in the chat about advocacy. And, for example, the challenges that schools face, both trying, when the classrooms are large, making sure that both lessons are completed and challenging behaviors are addressed, or, when children are on the buses or in the hallway, how can we be supportive of our children and also of our schools in, enhancing the mental health of our children and families and educators.
Just in talking with parents about the resources that are available, I think the resources that are available really are only as helpful as to the length that they are accessed. And so we still work to remove that stigma around accessing mental health and helping parents understand that if their child is going through a difficult time or needing support with their mental health, that it is not a scarlet letter or an indication that the parent has misstepped or that they've done anything wrong. But I think to really normalize the conversation around mental health being another form of health. So in the very same way that we seek it for our medical needs, that we would seek it in the way for our mental and emotional needs as well. So I think having the conversation and just ensuring that we are encouraging the use and accessing of the mental health supports that are available. I think to speak at board meetings, attend our board meetings or watch our virtual board meetings so that you know what the school system is up to, so that you can encourage funding of additional resources in our schools for students, but finding ways to advocate and to be present and to be vocal and supportive, be it in writing to our board, school board, who is extremely supportive of mental health services in our schools, but also attending PTAs and speaking to parents about the need to access the services that are available. So just finding ways to plug in and also talking to faith-based organizations and encouraging them to support the messaging of families utilizing all of the health services that are available to support our students and our families.
I would just say, generally speaking, and based on the literature, when addressing what Dr. Faison was mentioning about stigma, there have been studies to show that when services are provided in a natural environment for kids and their families, they're more likely to engage. So as much as we can push in supports to schools and also integrate physical health and behavioral health. So for instance, having therapists and psychiatrists available in pediatric offices to meet with families, those things help engagement and continuity of care for kids and their families in need of mental health support. If our cities and counties can bring up more mobile services as well, that can also meet with families in their homes, or the option of telehealth increases access and reduces burdens on families to access care, particularly when there are socioeconomic or resource issues that may prevent them from seeking out care. So I've, in my work with families in sort of large urban areas, is maybe not having childcare for their other kids, or not having transportation, or not being able to spend the time to get to the clinic or to this appointment to take off from work. So as much as we can make our access to care less stigmatized and more accessible, that helps with engagement. And then in Philadelphia, we've also noticed having peer support can be helpful. So parents who have children who've been through the mental health system or received treatment, engaging with parents who may be ambivalent or reluctant to meet them where they are, and to kind of address whatever resistance there might be to pursuing support. We found that can be helpful. And also for adolescents, if there are others with lived experience, sometimes that can be helpful with engagement.
Grace, did you want to add something?
Yeah, I echo, wholeheartedly both of what was just said. And then the last, favorite phrase of mine is really like the behavioral health or the therapy is medicine, through your ears. Really that message that, so all this, dialogue and, helpful communication and therapy or these interventions is really that. And we treat it just the same like we would a physical ailment. But, society just doesn't look, we're getting better. And part of these discussions is about that, is about normalizing and about getting, so we're not keeping those secrets and we're not, that shame. And so that's why I'm so glad to be, involved in this, this endeavor today and ongoing discussions, because that really is helping, the children and adolescents, talk about stuff and open. And so they are not kind of keeping those secrets, which will help, further their development and their healing.
That's all very helpful. And, I really, mention or want to expand a little bit on what Grace just shared. One of the things that we've seen in working with the military affiliated population is that they've really been actively pushing out and making sure that senior leaders are helping to spread the word that mental health is an important component of your success as a soldier, sailor, airman, Marine, and that your family's mental health is also critical to your success. And, do you see any opportunities for us to do that more on the civilian side as well, to increase the take up on mental health care services? And how can we encourage it? Dr. Everett, you looked like you were about to say something.
No, I was just thinking more about it. I don't know that I have a great answer, but I think, making it like having the message come down from leadership at various levels in our society, whether it be in the workplace setting, in schools, in the healthcare setting, through the media, just encouraging folks to, making it known that mental health is part of all of our health, not just, it's having a holistic approach to wellness, I think, in whatever your system or institution is, and including mental health in that, and making sure that people have resources and are supported in utilizing those resources if they're needed. I know that in my experience, sometimes folks have reported they were wary of utilizing resources at their job because they weren't made to feel like using them they were stigmatized for using them. So ensuring that there's adequate training on how to be sensitive and supportive of employees and others when they need to access resources, not just having them, I think is important, and having that message come from the top down.
Dr. Faison, anything you wanted to add there?
I really love that answer, and what it made me think about was the fact that our school system allows students to be absent one day a semester for a mental health day. It's a day that a parent can send an email to say, my child needs a mental health day today. And they just send a note and the student's absence is excused. They didn't need to go to the doctor or see a therapist in that day. But just as you referenced, creating this environment where it's okay to seek support and to just take it down a notch, even for a day, provides that breather for our students to be able to do that. And our school system put this in place a year or two ago, where they can say, this is a mental health day for me once a semester, and make up the work that they missed on the day that they were absent. So I think it's important for that message to, as you mentioned, from the leaders and legislators and more than just clinicians, but directors and employers everywhere, really expanding upon their wellness programs for employees. Just another example of that is a program in our school system called Burn Along. And it really is an exercise program that allows our employees to move and participate in videos through Zoom with their colleagues, but it really lends to that stress management and providing opportunities to take it down for a day, and just recognizing the connection between those hormones that are produced when we exercise and how they really become supportive of our wellness in general. So I think employers really creating these in supportive environments and lending where they can to give ease to wellness is a great strategy.
Yep. And I think that's a great info, Dr. Faison. And I think that we got a question of, is the mental health day in other areas of the country? And I think that's a great example of advocating, wherever you may be living, because we have people on today from all over the world. I know we're getting very tight on time, but I had one last question that was in the chat, and, maybe starting with Dr. Faison on this one too. The person was saying, they see some concerns where, they can see that a child is having some issues, and, they've spoken to the parents about it, but it hasn't resulted in any action. And can you maybe share some tips or strategies for how to have that conversation with a parent in a way that can help facilitate action? Because I can share, even from Easterseals' perspective, when we're dealing in early childhood education and we have to speak to a parent about, gee, we're seeing a speech delay here or something, it has to be handled very sensitively in order to help create action. So can you share any information on that?
I think what you just said is where I'd start. It is delicate because you may be dealing again with someone's idea about what mental health really looks like. And just the very mention that a student may be having a crisis may be difficult for a parent to acknowledge. And sometimes it does come from their own belief system, what they've never seen, what they've heard, stereotypes or myths about mental health. And so I think to really have the very delicate conversation about what you're seeing, and then providing further information and literature so that it's not just an opinion about something, but to help educate and the why. Why is it important to seek help, and what the benefits to their particular student may be, and then give it a little time. It is difficult to know that a student stands in need of something, and then the barrier be an individual who does not believe that is the right fix or the right strategy. So I think to approach it delicately and to provide as much information about the student. Unless the student is absolutely in crisis, then you may want to take additional methods to get the student supported. But if it is just, an observation where you have a little time around the parent taking action, then I would suggest just beginning right where you begin, where you reference the issue, just proceeding with caution and with information, I think, and with the understanding, affirming that it may be difficult to hear, but this is my observation, and then providing some additional literature that's factual to support what's being stated for their further education and consideration.
Well, I really want to take a moment to thank all of our panelists. This has been an eye-opening session for me, so I hope it was as well for the audience. And also want to mention, should you wish to access a replay or share this session or any of our past conversations, you can see those at candidconversations.ecl.org. And again, thank you to our panelists and to our audience.